Hello, my name is Lisa Maragakis. I'm a faculty member at the Johns Hopkins University School of Medicine and a site advisor for Medscape Infectious Diseases. Today I'd like to speak with you briefly about noroviruses and measures we can take to control the spread of these viruses within healthcare facilities. The CDC website is also an excellent resource to deal with this difficult problem. Noroviruses are a family of related non-enveloped RNA viruses that cause acute gastrointestinal illness in humans. These viruses are extremely contagious, and only a few viral particles are required to cause disease. They are also relatively stable on environmental surfaces and resistant to many commonly used hospital disinfectants such as quaternary ammonia compounds. The viruses are directly spread from person to person, but may also be transmitted by contaminated environmental surfaces, food, and water that contain viral particles. When individuals become ill and vomit, the virus may also be spread by the droplet route. Illness is characterized by an incubation period of approximately 12 to 48 hours, followed by the acute onset of non-bloody watery diarrhea, nausea, and vomiting. This may also be accompanied by a low-grade fever, malaise, and myalgias. Most individuals recover without intervention within 24 to 48 hours. However, some patients do require intravenous fluids for dehydration. When patterns of disease, such as I've described, occur, norovirus should be suspected even before confirmatory testing can be obtained. Stool specimens should be collected and sent to state laboratories or to the CDC for confirmatory testing by PCR. But intervention should be implemented immediately before receiving the results of confirmatory testing. Thorough and consistent hand hygiene is one of the best ways to interrupt transmission of noroviruses within any facility. Hand washing with soap and water is the recommended means, as the viruses are sometimes resistant to alcohol-based hand cleansers. Patients who are affected with acute GI illness should be placed in private rooms or cohorted with patients who have similar disease, and contact precautions should be used for these patients. Any healthcare worker who comes down with acute GI illness must be sent home immediately and not allowed to return to work in the healthcare facility until 48 to 72 hours after their symptoms have resolved. This is because virus is continually shed even after the symptoms resolve, offering a chance for further transmission of the virus. We have found that sharing of food, particularly at holiday parties and among healthcare personnel, is one mode of transmission in healthcare facilities. Therefore, these types of activities should be curtailed during a norovirus outbreak. In addition, the importance of environmental cleaning and disinfection cannot be overemphasized. The CDC recommends disinfection with a bleach solution at a dilution of 1 to 10 or 1 to 50, depending on the amount of contamination of the surfaces. Or other EPA-approved hospital disinfectants may also be used if they are approved for use in norovirus outbreak control. High-touch surfaces should be emphasized, and cleaning of bathroom facilities, particularly if they are shared among different individuals, patients, and healthcare workers. There are many related issues that I don't have time to discuss today, but if you have thoughts, concerns, or questions, please post them on the Medscape site, and I look forward to seeing your comments. Thank you for listening. This is Lisa Maragakis signing off for Medscape.